This isn't your typical health conference. Here, physicians, nurse practitioners, and psychiatrists from across Canada are learning how to provide MDMA-assisted psychotherapy.
What I'm going to do is go over this PowerPoint presentation.
MDMA is a synthetic stimulant and hallucinogen, more commonly known as ecstasy or Molly. In Canada, it's regulated and is illegal to use unless authorized for medical or scientific purposes and has been gaining popularity as a form of therapy. For 6 days in February, medical practitioners discussed the drug and its effects on the nervous system. They want to use MDMA to treat patients. To prescribe it, they must request permission from Health Canada.
I did the training for my patients. Each day that I'm in clinic, I hear from people what role trauma and PTSD play in their symptoms.
Dr. Laura McLean is a physician who specializes in sleep disorders. She says trauma, for many of her patients, is the underlying cause.
People blame themselves when they can't get better. And unfortunately, other people blame them when they can't get better as well. We have this term in medicine of patients being non-compliant. And I think it's a really disrespectful term because everybody's doing the best they can with what they've got, and we need to see people and really hear what they're telling us.
Practitioners like her are learning about the patient's experience taking MDMA. 20 people are in this round of training. It's put on by Theisel, a BC coalition of health practitioners who want to expand legal access to prescribed drugs like MDMA and psilocybin. It says another 200 medical professionals are on the wait list for future sessions. Since 2022, licensed physicians and other healthcare practitioners have been allowed to request access to MDMA and other restricted drugs through Health Canada's Special Access Program. Once a practitioner is approved, a Health Canada licensed manufacturer will mail them the drug. Health Canada has approved 41 MDMA requests since 2022. Ingrid Pacy is a Vancouver psychiatrist with more than 40 years of experience helping trauma survivors. She leads Theisel training sessions.
The role of the therapist is a bit different because the person may have a very interior journey and, have feelings and work through a lot of those issues internally, or they may engage the therapist. So there's actual psychotherapy that happens while the person is more open, less defensive, less afraid because they've taken MDMA.
She says MDMA can be a useful tool combined with therapy.
People go back to being young, to times of trauma, or in later years, times of some sort of trauma. And it's important to have somebody right there to comfort them, hold their hand, really support them in whatever they're going on.
She has administered MDMA through a Health Canada approved clinical trial and says a typical MDMA session lasts 4 to 6 hours. She recommends patients do 3 sessions spaced out over months. Her patients are given a dose and lay down on a bed, wear eye shades, and listen to music. Pacy teaches medical professionals how to provide talk therapy throughout the experience. In Canada, there are currently 2 ongoing MDMA clinical trials approved by Health Canada to uncover the benefits and health impacts.
However, it's definitely very encouraging. I mean, if you look at the results of the studies, the rates of improvement were substantially larger than with what we have traditionally at our disposal. And that includes antidepressant medicines and usual talk therapies like cognitive behavior therapy.
The drug can cause side effects, including high blood pressure, nausea, and panic attacks, and is not currently accepted for medical use in the U.S. But the U.S. Food and Drug Administration is reviewing an application to approve MDMA-assisted therapy for PTSD. That decision could come down later this year. Health Canada says it's monitoring that U.S. review with interest. This UBC drug policy professor says practitioners here need to be prepared in case access expands.
And it's really, really important that they do it within the context of skilled therapeutic practice. And MDMA therapy is completely different from regular therapy, and we need as many therapist trained as possible so when the door opens, we can provide this service widely.
But with the excitement around MDMA comes caution. The trial groups have been small and generally white. This doctor says there is still a lot we don't know.
Oftentimes, people with other psychiatric illnesses or addictions or substance use disorders were not included in these studies. Those that were actively suicidal were not included in these studies. So we don't know if MDMA therapy is necessarily going to help all patients with post-traumatic stress disorder.
Hussein is also calling for a standardized approach to training therapists who will be working with people under the influence of drugs who can be vulnerable. In 2019, 2 BC therapists were reprimanded for their treatment of a PTSD patient during a clinical trial for MDMA-supported therapy. The research organization determined the pair had deviated from acceptable practices, which it labeled as unethical. Hussein says these cases are wrong and also rare.
We want to make sure that we have some oversight into the standards that therapists are adhering to and the training requirements that they meet. At this point, there is no governing body to oversee psychedelic therapies, including MDMA therapy.
From her practice in Maple Bay, Dr. McLean recognizes MDMA-assisted therapy is not for everyone, but wants to support the patients who seek it out.
It can help them re-look at the memories and change the story, see it from a different perspective. And this can help people really heal from this deep trauma that's been holding them hostage for their lives.
She has patients, she says, who are already interested. Yasmine Ghania, CBC News, Vancouver.